Since you are thinking about becoming a midwife, I would just like to let you know that caring for the mom and baby does not stop at childbirth and continues on as the mother experiences new life changes with her body, with her mental status, and being a new mom or caring for a new child. So the mom may experience postpartum depression, which is a major depressive episode with the onset of pregnancy or within 4 weeks of childbirth. She may have postpartum blues, which is a letdown feeling with irritability and anxiety that usually begins 2 to 3 days after giving birth, and it usually disappears within a week or two. Postpartum anxiety, it is having anxiety and stress after childbirth. This can be associated with being a first-time mom, caring for the baby, finding support, just overall worrying. Postpartum psychosis is postpartum depression with psychotic features. So this will be inclusive of auditory or visual hallucinations, paranoia and grandiose delusions, elements of delirium or disorientation, and extreme deficits in judgment accompanied by high levels of impulsivity that contribute to increased risk of suicide or infanticide. So, postpartum psychosis is a psychiatric emergency, and if your mom is experiencing this, she will more than likely need inpatient psychiatric care. So women who are at greatest risk for these conditions are those with history of anxiety or depression episodes, those who have previous episodes of major depressive disorder in the past. Other risk factors include young age and unattended pregnancy, histories of premenstrual dysphoria, a family history of mood disorders, unmarried status or single mom, lack of social support, socioeconomic deprivation, low education, substance abuse, and stressful life events. And so teaching that can be done by the nurse. You can teach them to relax and take time to themselves for 15 minutes, 30 minutes, 5 minutes. Anything helps. Eat a well-balanced diet and exercise whenever possible. Get out of the house and get fresh air. Take time to yourself. Don't overcommit yourself or feel like you have to do it all by yourself. Don't place unrealistic expectations on yourself. No one is perfect. And you can offer support group information or other resources within the community that she can reach out to get better support that way. And so some interventions that can be done by the nurse. You can assess the woman for risk of depression. You can give info about signs of postpartum depression and anxiety. You can maintain frequent contact with the mom and do house visits to check the overall status of her and the baby. You can assess for suicidal thoughts and plans prior to discharge. You can encourage a woman to express her anxieties, fears, and other feelings, and to have as much contact with the infant as possible to create a bond, because that'll help decrease the onset of these as well, and it will also help treat them when the mom bonds more with a baby. It just tends to have an overall better experience postpartum and helps decrease the occurrence of these different conditions.